Go ahead and lie on your backs. Get yourself comfortable. And just begin to bring your attention to this moment, how you're lying on the floor now, scanning your body, feeling the weight of the back of your head, and just noticing if you feel like your head is resting right in the center, or is it turned or tilted just a little to the left or the right? Not to fix it or correct it, but just to kind of notice that when I lie down and I think I'm resting, this is how I'm organized. This is how I land. And then notice your right and left shoulders. You might notice how much contact you have with each shoulder blade. Is there more or less pressure on one side or the other? You might notice, does the tip of one shoulder seem more lifted away from the floor than the other side? Or maybe one shoulder feels a little closer to your ear. Or not. These are very small distinctions that initially, for some people, can seem very hard to notice the differences. We're really not used to creating these very subtle distinctions. And yet one of the things that happens when a person has been experiencing pain for a long time is that area in your brain that kind of has a map of your body. It's called the homunculus. And it can get kind of smudged. It can get unclear and fuzzy. And then that fuzziness actually makes the brain worried about its body. And the worry of the brain can sometimes create more pain to try to protect you. So I think Feldenkrais lessons and other body things like yoga can be helpful this way. Help re-clarify a more detailed map in the brain so it can find you and use all of you for movement. Now, scanning down your body, you might notice if your lower back curves away from the floor a little bit. Notice the weight of your pelvis and sacrum. And just notice if you were going to roll to your left or your right, is your pelvis already just turned a little bit one way more than the other way? And then notice how each of your legs is resting. If you were to draw a line right through your center and down between your legs, is each leg the exact same distance from the center? Maybe one leg is a little closer or farther. Maybe one leg is rolled out a little farther. And then remember, through this lesson, we're going to spend the entire time on our backs, but at any point, if you need to bend your knees so your back is comfortable, if you need to take a break on your side, always, always the most important thing is that you're learning to listen and take care of yourself and not to sort of suffer through the instructions of the teacher. And so what I want you to start with is to just gently roll your head to the left and to the right. And just sort of notice how far does it easily go. Again, you're not stretching it. We're not doing range of motion measurements. you're just noticing the quality of that movement. Feeling for that very first point of resistance. And then just go ahead and pause in the middle. And go ahead and bend your knees up one at a time. And place your feet so that your knees feel balanced, so they're not falling in or falling out. There's just a little bit of space between your feet. Your knees are bent. And then I want you to just very gently take your knees just to the right, and only as far as comfortable. So we're not doing a big stretch. You just slowly, like even an inch might be enough for some of you. Take them to the right and just as easily and effortlessly bring them back to the center. So some of you might be flexible enough to take your knees to the floor, and others of you just might go a very slow and gentle 1 or 2 inches to the side. And as you're rolling them to the right and back to the center, just feel how your pelvis rolls to the right. And how far up your spine do you feel that invitation for rotation? You might only feel it in your pelvis. You might feel your lower back turning. You might feel it a little bit through your ribs. And as you do what seems like this very simple movement, just going to the right and back to the middle, also notice if you're breathing, if your breath is free and easy, and see if your jaw is tensed or soft. So just kind of let your jaw be soft. And then leave your knees back in the middle. And just notice lying there, having gone just to one side and back to the middle, if that has changed how you're lying on the floor at all. Does it change how you notice the pressure behind your pelvis, the weight of your legs, the back of your head? So in these Feldenkrais movements, we pause a lot. And it's clearly not because you're short of breath, but it's so the attention, right? So we're really learning to attend to ourselves differently. And that is a different kind of brain fatigue. Because we're, again, just like our mindfulness practices, we're really used to letting our mind just kind of run wild, think whatever thoughts it wants to think. So when we bring it to these kinds of practices, it's a new kind of exercise. So knees up again, if they're not already up. And this time I want you just to gently turn your head to the right and back to the middle. So for a while, we're just going to take everything to the right and back to the middle. And feel the line that the back of your head makes as you take your head to the right and back to the middle, just the head. Noticing your breathing. And just take your attention as you turn and just notice, again, how far down your spine can you feel the connection of the movement from the head? You turn your head to the right, your neck vertebrae move, And do you feel any subtle invitation or tendency for the upper thoracic vertebrae or ribs to just lean a little rightwards, following your neck? And maybe you do, and maybe you don't. No right or wrong, just noticing what is. And always listening. For some of you, 2 or 3 turns might be plenty for your neck. And for others, you know that your body can tolerate several. And then again, just pausing in the middle. If you're able to, let your legs down long. And just once or twice, turn your head to the right and to the left. We've done just a few very simple movements, but sometimes some of you might begin to notice changes are occurring. And then just pause in the middle. And then again, please bend your knees up. And this time, take your knees as far as is easy and comfortable to the right, and take your head to the right, both to the right. And just notice, even though you might feel the rotation of the knees and the pelvis and maybe the low back, and the rotation of the head and the upper back and the neck, can you begin to feel how the head is connected to the pelvis and the legs? Everything going lightly and easily to the right and back to the middle. Good. And then pause again in the middle. And take one of your arms and reach it sort of under the opposite armpit and behind your shoulder. Mm-hmm. And then the other arm is on top, reaching the other shoulder. There we go. Good, good, good. Good job. Oh, there's one. There we go. And of course, if you can't reach all the way across for whatever reason, you can just kind of hold your upper arms. But what I want you to do is take your left hand and pull your right shoulder. So you're rolling yourself to the left with your right hand. Wait. Yeah, your right hand, left shoulder. You're rolling yourself to the right with your right hand. And then your left hand pulls your right shoulder towards the left. So you're just creating a rolling motion. You're just rolling. But you're kind of trying to initiate it from your hands pulling on your shoulders, left and right, while breathing, while keeping your jaw soft, and noticing if your head wants to follow, and maybe even your knees want to follow. Just feeling that gentle rolling left and right, connecting that middle of your spine to your head and your pelvis. Nice. And then let your arms rest, let your legs rest. Just feel your contact with the floor and enjoy your life. Here you are, giving yourself permission to roll around on the floor like a baby. What could be better besides chocolate? All right, and go ahead and bend your knees up again. And this time, I want you to begin to gently roll your head to the left and take your knees to the right. And back to the middle. Several times. And see if you can kind of only take your knees as far one way as you're taking your head the other way. So you're sort of keeping them in balance, and then they both come back to the middle at the same time. Head left, knees right, and back to the middle. And then let everything pause in the middle. And pick a point on the ceiling. And keep your eyes fixated on that point on the ceiling while you take your head to the left and to the right. Notice if you're holding your breath at all, if you're tightening your jaw. Try to keep your jaw soft and your breathing smooth. You might even pace the rotation of your head with how you inhale and exhale. And then if you were to add your knees into this motion, which way would you want to take your knees? Would they follow your head or would they follow your eyes? Now, if you have any tendency towards dizziness or nausea, listen to yourself. You may want to keep your eyes more in line with your head. Sometimes this can be stimulating to the inner ear. And then just pause in the middle. You can either rest with your knees up or your knees down. Just notice how you're breathing now. Notice the contact of your right and your left shoulder blades, if anything is changing. The curve at your low back. The weight of your right and left legs. And then again, go ahead and bend your knees up. And I want you to bring your arms across your chest the way we did before. One arm under, one arm over. And then switch them so the other arm is under. So they're different than they were last time. And again, not crossed. One arm is really completely under the other arm to the armpit. Had it right last time.
What's that? Oh, okay.
Yeah, that's all right. Just easier that way. Okay, good. And then gently use your hand to pull your shoulder so it's rolling to the left and to the right. Just tuning into how you're breathing. Can you pace the rolling with the inhale and the exhale? And then see if you can gently, without straining your neck, take your head the opposite direction. So if your head is going to the right and your shoulders are going to the left, can you take your knees to the right? This is a little bit of walking and chewing gum, right? So your head and your knees go the same direction, but your shoulders go the opposite direction. And can you do that while breathing and allowing your jaw and your tongue to stay soft? And you might need to just go a little slower, a little softer. Try not to force it. And if you can't do it, you can't do it, and that's okay. It's kind of a puzzle for the brain. In fact, a lot of Feldenkrais lessons are really brain puzzles using the body. Good, and then just pause in the middle. Let your arms rest. Just let your weight, your body surrender to the floor, arms uncrossed and resting. And then again, bending the knees up, gently taking your head right and left, and see if you can roll your eyes in your head the opposite direction. Head right, eyes left. Opposite direction. Eyes and head. So your head rolls to the right and your eyes look to the left. It's not easy, right? So be playful with yourself. Often little kids will look in the mirror. Like I actually have a memory of looking in the mirror and turning my head and noticing that if I kept looking at my eyes, that my eyes were rolling separately from my head as a kid. Kids play with these things all the time. Now, as long as you're still breathing and your jaw is soft, can you take your knees opposite your head? So basically your knees are going the same direction as your eyes, and your head is opposite your eyes and your knees. So head, knees to the right, head to the left, eyes to the right. Knees to the left, head to the left, eyes to the right. We'll work on this. So when a baby comes out of the womb and is laid on its mother's chest, it has a rooting reflex. It immediately takes its lips to the side that it smells the milk and wants to nurse. And its whole nervous system goes that direction. Its lips, its eyes, its nose, its spine. And it's a primitive reflex for everything to go one way. And as the baby matures and learns to roll and walk and crawl and do all the things babies roll, it learns to differentiate that reflex. But interestingly, one of our stress responses is to kind of lock up and take everything to the left and everything to the right together. So this is it can potentially be a fun pause. Like if you catch yourself getting caught up and stressed out, to just pause and breathe and see if you can take your eyes and head in opposite direction, can kind of break up that, whatever that is that's kind of grabbed you and stressed you at the moment. If you remember to do it. Because when the stress has us, it often just has us. All right, let it all go. Let it all go. Let your legs down. Surrender. And just one last time, gently roll your head left and right. And you might notice the quality feels different. It might feel like you turn your head farther. You might feel lighter or heavier or taller or softer lying on the floor. And then tune back into your breathing, let your head rest. And I want you to find your way slowly up to standing. Sometimes our blood pressure will drop during these lessons, so take your time. But as you bring yourself to standing, stay in the lesson, stay in the sensations of how you feel. And you'll come up to standing while breathing. And then once you're up, standing, I'm gonna ask you a couple of questions. For those of you who are up, you might just kind of try turning your head to the left, to the right, just sort of noticing the quality of that. And if you notice anything about how you feel standing, if you have one or two words for it, just kind of share it with the room, because somebody else might resonate with your experience and somebody else might have a completely different experience. And it's kind of fun to notice that these movement lessons will land on each of your nervous systems completely differently. Thank you.